All right, today we're diving into a story that could seriously shake up the entire pharmaceutical world. We're talking about one of the most famous drugs on the planet and a bold new rival from India that's completely changing the game. Let's get right into it. So, you've almost definitely heard the buzz about drugs like Ozempic, right? They're everywhere. Total game changers for diabetes and weight loss. But just imagine, what if their biggest roadblock, that insanely high price, just disappeared from millions of people?
Well, that's not a what if anymore, because in India, that is exactly what just happened. A huge shift has started, and it's this incredible story of innovation, risk, and what this could mean for patients literally everywhere.
To really get why this is such a big deal, we got to start with the drug at the very center of this story. So let's cover the basics. What exactly is semaglutide?
Okay, so semaglutide is this really powerful medication. It's designed to help regulate blood sugar, and it can also lead to some serious weight loss. It is proven to be incredibly effective for type 2 diabetes, and honestly, it's become a revolutionary tool in the fight against obesity.
Now, you probably know semaglutide by its celebrity brand names, Ozempic, which is for diabetes, and Wegovy for weight management. Both are made by the pharma giant Novo Nordisk, and their wild popularity has turned them into what the industry calls blockbuster drugs. We're talking billions and billions in sales.
But, and this is a big but, there's a massive catch. These drugs come with a sky-high price tag. I mean, they can cost over $1,000 a month in some countries. That puts them completely out of reach for the vast majority of people who could actually benefit. And that cost problem? It's exactly what this story is all about to crack wide open.
So how do you fix a problem like that? Well, let's introduce an Indian company called Zydus Lifesciences. You see, they didn't just make a copy of the drug, they re-engineered the whole experience with one thing in mind: affordability.
And here it is. Meet Ujvira. That's the brand name for Zydus's generic semaglutide. Just by creating a generic, they're taking a direct shot at the big brand's market dominance, but it's how they're doing it that's so incredibly smart.
And this is where things get really clever. The secret sauce is in the pen itself. See, the original drugs come in these disposable pens. You use it, you toss it. Zydus went a different route. They made a reusable pen. You buy the pen just once, and it can last for up to 2 whole years. From then on, you just buy the much cheaper refills. It's such a simple idea, but it totally slashes the long-term cost. And hey, less plastic waste too. The process itself is super simple. A patient gets the reusable pen, they use a multi-dose drug refill, and whenever it's empty, they just pop in a new one. It's an elegant solution that's all about being accessible and easy to use. You can really boil Zydus' strategy down to 3 main pillars. Affordability, that's the big one of course, but making the treatment way more accessible to way more people is a huge piece of the puzzle. And you can't forget the sustainable, reusable design. That's a major plus for the environment. It's a really well-rounded approach. But this story isn't just about smart engineering. Oh no, it's also a high-stakes legal drama. You see, Zydus didn't exactly wait for permission to launch their product, which makes this what the industry calls an at-risk launch.
So what in the world is an at-risk launch? Well, it's when a generic company just decides to go for it and sell their version of a drug while the original company's patents are still active and, get this, being fought over in court. It is a massive, massive gamble. So this move basically sets up a huge showdown. Zydus Lifesciences, the Indian generic maker, versus Novo Nordisk, the global pharma giant holding the patents. It's a classic David versus Goliath fight, and it's playing out in the courtroom and on pharmacy shelves.
So let's break down how this legal showdown is playing out. On one side, you've got Novo Nordisk holding onto their patents. On the other, you have Zydus in court saying, hey, we don't think these patents are even valid. But here's the really bold part. Zydus isn't waiting around for the courts to decide, which could take years. Nope, they've already launched the product. They're basically betting the farm that they're going to win this legal fight in the end.
Okay, so let's step away from the business and legal drama for a second. What does all of this actually mean for the people who need this medicine? You know, why does this market disruption really matter?
Well, here's the bottom line. This chart says it all. Look at the huge difference in the potential cost of treatment. By bringing in a generic competitor, Zydus is creating this pressure that could lead to a whole new world of much lower annual costs. That could make this therapy available to a ton of people who were completely priced out before.
And this quote really gets to the heart of what the company says it's all about. According to Zydus, this isn't just a business strategy. It's about helping patients. The whole point is to tear down that cost barrier so more people can get a treatment that could truly improve their health and their lives.
Okay, so let's do a quick recap of the key points here. First, a global blockbuster drug now has its first generic rival in India. Second, the really cool innovation isn't just the medicine itself, it's that reusable pen that cuts costs and waste. Third, this has huge potential to lower prices and open up access for so many people. And finally, remember, this is all happening while a massive legal battle is going on in the background.
And all of that leaves us with this one giant question for the future. Yeah, this is happening in India right now, but is this just the first domino to fall? Could what Zydus is doing set off a chain reaction, leading to a worldwide price drop for one of the most important new drugs we've seen in a long time? I guess only time will tell.